Cirrhosis is a liver disease. Look at this picture, shows that normal liver and cirrhosis liver. CT findings and MRI findings. Look at this. A detail going on. Introduction. Cirrhosis is a chronic, progressive liver disease characterized by the replacement of healthy liver tissue with scar tissue. This leads to impaired liver function and significant complications. Often culminating in liver failure. It is a leading cause of morbidity and mortality globally and represents the final stage of chronic liver disease. Definition. Cirrhosis is defined as a diffuse process of liver fibrosis accompanied by the formation of regenerative nodules which disturbs the liver's architecture and function. It is typically irreversible but can be slowed or managed with proper intervention. Types. 1. Alcohol cirrhosis caused by long-term excessive alcohol consumption. 2. Non-alcohol steatohepatitis related to metabolic syndrome, obesity and diabetics. 3. Biliary cirrhosis result from chronic biliary obstruction and infection. 4. Post-hepatic cirrhosis occurs due to chronic hepatitis B or C infections. 5. Cardiac cirrhosis due to prolonged severe right side heart failure. 6. Cryptogenic cirrhosis where the cause is unknown or unclear. Causes. 1. Chronic alcohol abuse, alcoholic liver disease. 2. Chronic viral hepatitis, hepatitis B, C and D. 3. Non-alcoholic fatty liver disease. 4. Autoimmune disease, example autoimmune hepatitis. 5. Genetic conditions, example hemochromatosis, Wilson's disease. 6. Biliary obstruction, example primary biliary cholangitis, primary sclerosing cholangitis. 7. Prolonged use of hepatotoxic drugs. 8. Infections. 9. Vascular disorders affecting the liver. Example, Budd-Chiari syndrome. Risk factors. 1. Excessive alcohol consumption. 2. Chronic hepatitis infection. 3. Obesity and metabolic syndrome. 4. Unprotected sexual practices and needle sharing. Risk for viral hepatitis. 5. Autoimmune conditions. 6. Family history of liver disease. 7. Use of hepatotoxic medications. Complications. 1. Portal hypertension, increased blood pressure in the portal vein. 2. Ascites, fluid accumulation in the abdominal cavity. 3. Esophageal varices, enlarged veins in the esophagus prone to bleeding. 4. Hepatic encephalopathy, brain dysfunction due to ammonia buildup. 5. Jaundice, yellowing of skin and eyes from bilirubin buildup. 6. Hepatorenal syndrome, kidney failure associated with advanced liver disease. 7. Hepatocellular carcinoma, primary liver cancer. 8. Infections, increased susceptibility due to weakened immunity. Pathophysiology. Chronic liver injury leads to activation of hepatic stellate cells. Activated stellate cells produce excess extracellular matrix proteins, causing fibrosis. Disruption of liver microarchitecture with regenerative nodules and fibrotic bonds. Impaired blood flow causes portal hypertension. Loss of hepatocyte function lead to metabolic, synthetic and detoxification failure. Pathophysiology of cirrhosis, step-by-step process. 1. Initial liver injury. 2. Activation of hepatic stellate cells. 3. Production of extracellular matrix. 4. Loss of hepatocyte regeneration. 5. Disruption of liver microarchitecture. 6. Portal hypertension and its effects. 7. Loss of liver function. Fibrosis and loss of functional Hepatocytes result in impaired liver functions. Metabolic dysfunction, reduced ability to process toxins, example ammonia, leading to hepatic encephalopathy. Synthetic dysfunction, decreased production of albumin causing edema and clotting factors, increased bleeding risk. Excretory dysfunction, impaired bilirubin exertion causes jaundice. 8. Immune dysregulation. 9. Progression to end-stage liver disease. This often necessitates liver transplantation as the definitive treatment. By understanding these steps, the progression of cirrhosis can be recognized and interventions can be targeted to slow its advancement and manage complications. Signs and symptoms. 1. Fatigue, weakness, nausea, weight loss and abdominal discomfort. 2. Late stage jaundice, ascites, spider, angiomas, pulmonary erythema, pruritus, gynecomastia in males, EC, bruising and bleeding, confusion and disorientation. Encephalopathy. Diagnosis, history and physical examination. Assessment of risk factors, signs and symptoms. 2. Blood tests, liver function test, ALT, AST, ALP, bilirubin, coagulation profile, PT and INR. Complete blood count, CBC. 3. Image studies, ultrasound, CT scan or MRI, transient elastography. 4. Liver biopsy, confirm the diagnosis and assess severity. 5. Endoscopy, checks for esophageal varices. Nursing diagnosis. 1. Impaired liver function related to hepatic fibrosis. 2. Risk for bleeding related to coagulopathy. 3. Fluid volume excess related to portal hypertension and ascites. 4. Risk for infection related to immune dysfunction. 5. Disturbed body image related to jaundice and ascites. Management. Medical management. A. Pharmacological therapy. 1. Diuretics. 2. lactulose for encephalopathy, 3 beta blockers, 4 antivirals for hepatitis B and C. B. Endoscopic interventions, band ligation or scleropathy for variceal bleeding. C. Surgical interventions, 1. Transjugular intrahepatic portosystemic shunt, 2. Liver transplantation in end stage cirrhosis. C. Dietary management, low sodium for ascites, to protein restriction in encephalopathy in severe cases. Nursing management, 1. Monitor vital signs, abdominal growth and fluid balance. 2. Educate patients about dietary modification and medication adherence. 3. Provide psychological support for body image concerns. 4. Administer medications as prescribed. 5. Prevent complications by reducing infection risk and monitoring for bleeding. Treatment options, addressing underlying causes, example abstinence from alcohol, antiviral therapy for hepatitis. Symptom management, diuretics, paracentosis for ascites, liver transplantation as a definitive treatment for end stage disease. Psychosocial medicine, 1. Emotional distress due to chronic illness and body image changes. 2. Social and financial challenges from reduced work capacity. 3. Importance of counseling and support groups. Prevention, 1. Limit alcohol intake. 2. Maintain a healthy weight and manage diabetes. 3. Get vaccinated against hepatitis B. 4. Practice safe sexual habits and avoid sharing needles. 5. Regular liver health checkups if at risk. In conclusion, cirrhosis is a serious and life-threatening condition with diverse causes and significant impacts on quality of life. Early identification, appropriate management and preventive measures are crucial for improving outcomes. With advances in medical and surgical care, many complications can be effectively managed and patients can achieve better quality and longevity of life. Thank you. Have a nice day.